Welcome to the deep dive. Today, we're diving into something vets see quite a bit. Pets suddenly drinking a ton and consequently peeing a ton.
Mm,
We call these signs polyuria and polydipsia, PUPD for short. And they aren't diseases themselves, but they're really important clues. Signals that something else is going on inside your pet.
exactly. They're like the body's check engine light sometimes.
Yeah, that's a good way to put it. We've got some excellent source material to guide us today. Real expert insights into, what PUPD actually is, the frankly surprising number of things that can cause it, and how vets work through it all.
It's a complex area for sure.
It really is. So our mission here is to unpack all of that for you. We'll explore how the body normally handles water balance, why that sometimes goes wrong, what kinds of health issues might be behind PPD, and how the diagnostic process works based on this information so you can be better informed.
Sounds good. Let's start with the basics then. What are PU and PD?
Right. Definitions.
Okay, so polyuria, PU, that's essentially producing a larger volume of urine than is typical. Our source gives us some numbers to anchor that. For dogs, it's usually over 45 milliliters per kilogram of body weight per day.
Okay.
And for cats, it's a bit lower, over 40 milliliters per kilogram per day. These are general guidelines, of course.
And the drinking part. PD.
Polydipsia, PD, that's taking in more water than usual. And the numbers here are higher, often because the drinking is trying to make up for the urine loss, right?
Compensating.
Exactly. So for dogs, it's generally considered over 90 milliliters per kilogram per day. And for cats, it lines up with their urine output guideline, over 45 milliliters per kilogram per day.
How do you actually confirm it, though? I mean, it sounds like a lot of measuring.
Well, yeah, the gold standard is actually measuring the water intake and urine output over a full 24 hours. Ideally, you do it for like 3 to 5 days to get a reliable average.
That sounds challenging for a pet owner.
It can be, definitely. So another really useful tool is checking the urine concentration. We use something called urine-specific gravity, or USG. If the urine is nicely concentrated, say, the USG is above 1.030 in dogs, or 1.035 in cats, it makes persistent, significant PUPD less likely.
Because the kidneys are doing their job holding onto water.
Precisely. Very dilute urine, that low USG, that's usually what flags a real water balance issue causing the PU.
Okay, that distinction is really important, isn't it? Because sometimes people might just notice their pet asking to go out more often. That's not quite the same thing.
Yes, that's a crucial point. You absolutely need to differentiate PUPD from something called polyuria.
Polyuria. Okay.
Polyuria is just increased frequency of urination, but critically, the pet is usually passing only small amounts each time. They might even look like they're straining, or you might see discomfort, maybe even blood sometimes.
So like needing to go constantly, but not much comes out.
Exactly. Whereas with true PU, the animal is voiding large volumes each time, which adds up to that high total daily output. It's all about the volume per urination. That's the key difference you need to understand.
Got it. Volume versus frequency. Makes sense. So we know what it is, how to spot it, but what's happening inside? How does the body normally control all this water, and where does the system break down?
Right. It's actually a pretty elegant system when it's working correctly. It involves a coordinated effort between the kidneys, the brain, specifically parts called the hypothalamus and the pituitary gland, and a really important hormone.
ADH.
ADH, yeah, antidiuretic hormone. You can think of it as the body's main water conservation signal. It tells the kidneys to hold on to water.
So how does it know when to send that signal?
The main trigger is the concentration of the blood, what we call plasma osmolality. This is mostly determined by the sodium level. If your blood gets too concentrated, maybe because you're a bit dehydrated, the hypothalamus senses this and tells the pituitary gland, release more ADH. ADH then travels to the kidneys and essentially instructs them to reabsorb more water back into the body instead of letting it go out in the urine.
And that makes you thirsty too, right?
Yes, exactly. That concentrated blood also triggers the thirst center, also in the hypothalamus, prompting you to drink. There are also volume receptors, sort of pressure sensors in the heart, and big blood vessels that play a role too.
Okay, so how does this relate to PUPD? Where's the failure point?
Well, in the most common scenario, the problem starts with the PU. The kidneys are losing too much water. This could happen for two main reasons. Either there isn't enough ADH being produced or released by the brain,
Okay.
or the kidneys themselves aren't responding properly to the ADH signal, even if it's there.
Okay, so the signal isn't getting through.
Right. Either way, the result is excessive water loss in the urine. This makes the blood too concentrated, hypertonic. That, in turn, strongly stimulates the thirst center, causing the polydipsia, the PD, as the body desperately tries to compensate and rehydrate.
So in that case, the peeing comes first, and the drinking is the response. PU primary, PD compensatory.
Exactly, that's the usual pattern.
Is it ever the other way around?
It can be, though it's less common. You can have primary PD where the excessive drinking is the initial problem. Maybe it's a behavioral issue or something else stimulating thirst inappropriately.
So the pet just drinks loads.
Yes. And if they drink way too much water, their blood becomes too dilute, hypotonic. The body senses this and says, whoa, too much water here. So it reduces ADH secretion.
Ah, it tells the kidneys to let more water go.
Precisely, leading to a compensatory PU. The kidneys are just doing their job trying to get rid of the excess water the animal drank.
So it's this really fine-tuned feedback loop involving the kidneys, the pituitary, the hypothalamus. Problems can crop up anywhere along that chain. Are certain pets more likely to run into these issues?
Well, both dogs and cats get PUPD. But yes, certain conditions do tend to show up more in specific groups. You might see some congenital problems they're born with, like certain forms of diabetes insipidus or kidney development issues more in younger animals, and sometimes in specific breeds known to carry those traits.
Okay.
Things like Addison's disease or hyporhinocorticism and some of those primary drinking problems also often affect younger to middle-aged dogs.
And older pets.
Yeah, many of the really common culprits behind PUPD tend to hit middle-aged and older pets more often. Things like chronic kidney failure, Cushing's disease, hyperadrenocorticism, or HAC in dogs, hyperthyroidism in cats, certain types of cancer. These are often diseases of older animals.
Are there other risk factors mentioned? Like things that might make it more likely?
The source definitely points some out. If a pet already has known kidney or liver disease or an existing endocrine disorder, they're at higher risk. Certain medications are big triggers too.
Like what?
Diuretics, obviously, that's what they do. But also corticosteroids like prednisone, they're notorious for causing increased thirst and urination. Even some anti-seizure medications can do it. And diet can even play a role sometimes. The source mentions things like very low protein diets, or conversely, diets very high in salt as potential factors.
Wow. It really does sound like PUPD is this major signpost that could point down many, many different roads.
Absolutely. And often it's the first sign an owner notices that something serious is wrong. The source material actually groups the causes based on where in that water balance system the breakdown is occurring.
Okay, that seems logical.
So one big category is primary PU, where the kidneys fail to respond properly to ADH. We touched on some of these. Chronic kidney disease is a huge one.
Right.
Also, Cushing's disease in dogs, hyperthyroidism in cats, serious infections like pyelonephritis, which is a kidney infection, or pyometra, a uterine infection. Liver failure fits here too. Electrolyte imbalances are important causes, especially high calcium or low potassium. Even things that sort of wash out the inner part of the kidney, like being on very low protein diets for a long time, or certain drugs, or rare congenital kidney issues, they all fall under kidneys not responding to ADH.
That's already a long list. What else?
Another type of primary PU is caused by what's called osmotic diuresis. Basically, there's something dissolved in the urine that's pulling extra water out with it.
Like sugar and diabetes.
Exactly. Diabetes mellitus is the classic example. High blood sugar spills into the urine and water just follows it out passively. But other things can do too rare, kidney tubule problems causing glucose loss, the diuresis that happens after relieving a urinary blockage, even giving certain IV fluids or substances like mannitol or lots of salt.
Okay, so stuff in the urine, dragging water out. What's next?
Then you have primary PU caused by a lack of ADH itself. The brain just isn't making or releasing enough. This is central diabetes insipidus, or CDI.
What causes that?
It can be caused by trauma to the head, tumors in the pituitary area, sometimes it's congenital, or sometimes, frustratingly, we just can't find a specific cause. We call that idiopathic.
Right.
And then finally, you have that less common category, primary PD, where the problem starts with the drinking.
The behavioral drinking or...
It can be behavioral, yeah, sometimes called psychogenic polydipsia, but it could also be triggered by things like fever or pain or very rarely actual disease affecting the thirst center in the brain, like a tumor or inflammation right there.
Goodness, that list is daunting. If you're the vet faced with a pet drinking and peeing excessively, How on earth do you start sorting through all those possibilities?
That's where the detective work really kicks in.
Oh.
And the source stresses how vital the other signs are. PUPD rarely happens in total isolation.
So you look at the whole clinical picture.
Exactly. You look at everything else that's going on with the pet. For instance, is there weight loss happening alongside the PUPD?
Okay, yeah.
If yes, that immediately makes you think about a different subset of diseases, maybe kidney failure, uncontrolled diabetes, hyperthyroidism, severe infections like PIO or PILO, maybe liver failure, Addison's, or even cancer causing that high calcium level we talked about.
What if the appetite changes?
Great question. Is the appetite decreased? That might point towards kidney disease again, infections, cancer-related high calcium, liver issues, Addison's. But what if the pet is ravenous, eating more than usual?
Polyphagia.
Right. That shifts your focus towards things like diabetes again, or hyperthyroidism, Cushing's disease, maybe even acromegaly, which is rare.
What about physical signs,
Mm,
like skin changes?
absolutely. Bilateral symmetrical hair loss, that screams endocrine disease. Cushing's or sometimes thyroid issues. Is it an intact female dog who was recently in heat?
Yeah.
You have to consider pyometra high on your list.
And what if the drinking just seems off the charts?
Yeah.
Like the pet is obsessed with water.
If the polydipsia is really extreme, the animal is constantly at the water bowl, seeking water everywhere that might make you lean a bit more towards primary polydipsia, or those rarer diabetes insipidus conditions, CDI or NDI. The severity can be a clue.
So you use all these associated signs to build a suspect list, basically.
Precisely. PUPD is just one piece, maybe the most obvious piece, but the rest of the puzzle helps you figure out where to look first.
Okay, so you've gathered the history, done the exam, got your clues. What are the go-to tests? What's the next step in the workup?
The absolute foundation is what we call minimum database. A CBC, complete blood count, a serum biochemistry panel, and a urinalysis.
The basics.
The basics, but
Yeah.
they give you so much information. The urinalysis is critical. First, it confirms the PU is the urine actually dilute like we expect. It helps assess concentration ability.
And look for other things, yes.
Does it have glucose in it? Boom. Diabetes mellitus is high on the list. Does it show signs of infection, like white blood cells, bacteria, maybe casts? That points towards pyelonephritis, the kidney infection.
Okay. And the blood work.
The blood work gives you that broader picture. Kidney values, BUN, and creatinine, are they elevated? That suggests a kidney cause. Or maybe the pet's just dehydrated because they can't drink enough to keep up. Low BUN could hint at liver failure.
What about electrolytes?
Crucial. Sodium levels, as we mentioned, can sometimes hint whether it's primary PU or primary PD, though there are exceptions like Addison's disease where sodium is low, but it's primary PU. Potassium is important too. High potassium, especially with low sodium, strongly suggests Addison's. And calcium, you need to check ionized calcium specifically, as high levels directly cause PUPD.
Liver enzymes.
Yep. High liver enzymes could point to Cushing's, hyperthyroidism in cats, primary liver failure, pyometra, even diabetes or drug effects. High blood glucose obviously points to diabetes mellitus.
And the CBC, the blood cells.
That can show signs of infection or inflammation, like a high white blood cell count, particularly neutrophils. That might support infection, like pyelonephritis or pyometra, or could be seen with Cushing's or steroid use too. Anemia might be seen with chronic kidney disease.
So those initial tests can really narrow things down.
Often, yes. They might give you a clear diagnosis like diabetes or point strongly towards kidney disease or infection, or they might guide the next steps.
It's like imaging.
Exactly. Abdominal x-rays, or more often these days, ultrasound. Ultrasound is fantastic for looking at the kidneys, their size, structure, signs of infection. You can look at the liver. Is it small, suggesting failure or a shunt? Are the adrenal glands enlarged, hinting at Cushing's? In an intact female, you check the uterus for pyometra.
And if the basics in imaging still don't give you the answer, are there more specific tests?
Oh, definitely. Depending on your suspicions, based on those initial results and the clinical signs, if you suspect Cushing's in a dog, you'd run specific hormonal tests, like an ACTH stimulation test or a low-dose dexamethasone suppression test.
For cats.
For cats with suspected hyperthyroidism, you measure their thyroid hormone levels, thyroxine or T4. If liver failure or a shunt is suspected, you might run bile acid tests. If you suspect pyelonephritis, despite a quiet urinalysis, a urine culture is essential.
What about things like infections or cancer?
You might test paired antibody titers for leptospirosis if that's common in your area and suspected. If lymph nodes are enlarged, aspirating them can check for lymphoma, which can sometimes cause high calcium.
Okay, so a layered approach. But what about those really tricky cases where everything else seems normal, but the pet is still drinking and peeing excessively? Maybe you suspect DI or primary PD. Is that where those water deprivation tests come in?
Exactly right. Tests like the modified water deprivation test, often followed by an ADH response test, are generally kept for those situations where the more common causes, kidney disease, diabetes, Cushing's, etc., have been pretty thoroughly ruled out.
And the goal is to sort out those specific problems.
Yes. Primarily, it's designed to differentiate between central diabetes insipidus, not enough ADH,
Yeah.
nephrogenic diabetes insipidus, kidneys ignoring ADH, and primary polydipsia, drinking too much.
How does it work, basically?
Well, the core idea is to safely dehydrate the patient slightly by withholding water under very strict supervision and see if their body responds appropriately by concentrating the urine. Can they produce ADH? And can the kidneys respond to it?
Okay. What are the possible outcomes?
So let's say you carefully restrict water, monitor closely, and the pet's urine does become properly concentrated. That tells you their ADH production system and their kidney response are likely intact.
So if everything else was ruled out,
Then you'd presume it's likely primary polydipsia. The system works, they were just overriding it by drinking too much.
okay, what if the urine stays dilute even with water deprivation?
Ah, okay. Then you move to the next step, usually giving a dose of synthetic ADH, like DDAVP, if the urine then concentrates after getting the synthetic
It
hormone.
means the kidneys can respond, they just weren't getting the signal.
Precisely. That points towards central diabetes insipidus. The brain isn't making or releasing enough ADH.
And the third possibility.
If the urine stays dilute during water restriction and it still stays dilute even after you give the synthetic ADH.
Then the kidneys just aren't listening, even when the signal is loud and clear.
You got it. That suggests nephrogenic diabetes insipidus, the kidneys are resistant to ADH's effects.
That seems like a powerful test, but I imagine you had to be careful.
Extremely careful. The source emphasizes this. These tests are absolutely contraindicated in animals that are already dehydrated or azotemic, have high kidney values. There's controversy around the full test, and it requires constant monitoring weight, hydration status, urine concentration. Sometimes just doing the ADH response part without the full deprivation might be considered safer if CDI is strongly suspected.
And giving ADH if it is primary PD could be bad.
Very dangerous, yes. If an animal that drinks excessively for behavioral reasons is given ADH, they might continue to drink but be unable to pee out the excess water, leading to water intoxication, which can be life-threatening. So definitely test to be used selectively and with caution.
Makes sense. So let's say you've done the detective work, run the tests, and finally figured out the underlying cause. What's the approach to treatment?
The absolute main goal is always treat the underlying disease. If it's diabetes, manage the insulin. If it's Cushing's, treat the Cushing's. If it's pyometra, surgery is usually needed. You fix the primary problem.
But what about managing the PUPD itself in the meantime, especially the excessive drinking?
This is probably the single most critical point for owners to understand, and the source is very clear. Unless you are under the direct and specific guidance of your veterinarian for a diagnosed case of primary polydipsia, you must never restrict water access for a pet with PUPD.
Never limit the water bowl.
Never. These animals are losing massive amounts of water through urination because of the underlying disease. Their increased drinking is the only thing keeping them from becoming dangerously dehydrated. Taking away their water can lead to severe dehydration, electrolyte crises like hypernatremia, high sodium, hypovolemic shock, and kidney injury very, very quickly.
So free access to water is non-negotiable.
Absolutely. Always. Unless they are actively vomiting and can't keep water down.
What if they are vomiting or just can't drink enough to keep up?
That's when veterinary intervention with fluid therapy is essential. Usually that means intravenous or IV fluids to correct dehydration and maintain hydration until the underlying cause can be managed or the pet can drink adequately again. The type of fluid might vary depending on the cause, often lactated ringers, but sometimes others like D5W or even just plain water orally or via tube might be needed if the issue is pure water loss.
You mentioned an exception for primary polydipsia.
Yes, that's the one situation where managing water intake is part of the treatment because the excessive intake is the problem. But even then, it's done very carefully and gradually.
How so?
You slowly reduce the available water over days or weeks, aiming for a normal daily intake volume for their size.
Mm.
This has to be done cautiously to avoid causing dehydration and also to manage potential behavioral fallout, like the pet becoming frantic, barking, or even trying to drink from undesirable sources like toilets if their water is cut off too abruptly.
So slow and steady with close monitoring.
Very close monitoring. Sometimes vets might use oral salt or sodium bicarbonate temporarily to help encourage the kidneys to regain their concentrating ability after being washed out for so long. Behavior modification techniques might also be part of the plan.
And other medications, besides fluids.
Well, the specific drugs depend entirely on the diagnosed cause, as we said. Insulin for diabetes, thyroid medication for hyperthyroidism, antibiotics for infection, drugs to manage Cushing's, and so on. The key point from the source regarding medication is the warning against using ADH or its analogs like DDAVP in patients with primary PD because of that risk of water intoxication.
Right. And being careful with drugs if kidney or liver function is already compromised.
Yes, definitely need to consider how drugs are metabolized and excreted if those organs aren't working well.
Okay, so treatment is underway. What about ongoing care and monitoring? What do people need to keep an eye on?
Monitoring is definitely key. You need to track their hydration status. Are they bright and alert? Are their gums moist? Is their skin snapping back normally? Body weight is a simple but useful indicator too.
Can tracking water intake still be useful?
Yes. Measuring water intake and maybe even urine output, if feasible at home, can provide a good baseline and help gauge how well the treatment for the underlying condition is controlling the PUPD.
And potential complications to watch out for.
The biggest risks usually circle back to inadequate water intake relative to the ongoing urine losses. So dehydration is the main concern, potentially leading to those serious consequences like shock or severe electrolyte imbalances, especially hypernatremia if access to water is ever limited inappropriately.
Okay. So pulling this all together from our deep dive today,
Yeah.
it's really clear that polyuria and polydipsia are major clinical signs in our pets. They're not diseases in themselves, but symptoms
Important symptoms.
that point towards a really wide range of possible underlying health problems. Could be hormones, could be kidneys, liver, infections, even behavior.
That's right. And figuring out the specific cause involves that careful process, listening to the history, looking for other clues, running initial tests like blood work and urinalysis, maybe imaging.
And sometimes those more specialized tests like water deprivation if needed.
Exactly. It's a step-by-step investigation.
And the treatment has to be tailored specifically to whatever you find, with that absolute key takeaway. Always provide free access to water unless your vet explicitly tells you otherwise for very specific reasons.
Couldn't stress that enough. PUPD really underscores how often subtle changes can be the first hint of significant underlying disease.
It really does. Thinking about just how many different conditions affecting completely different organ systems can all show up initially as just drinking and peeing more. Well, what does that tell us about how vital that precise fluid and electrolyte balance is for the whole body?
It's fundamental, isn't it?
Yeah. It seems like upsetting that balance, even slightly, can just send ripples out and affect systems that seem, totally unrelated at first glance. It really paints a picture of the body as this incredibly complex, interconnected system.
A very interconnected system indeed.
Well, thank you for joining us in this deep dive. We really hope this gives you a much clearer understanding of what PUP can mean if you ever encounter it in a pet.